All right. Good morning. We'll go ahead and get things kicked off this morning. Thank you. Thank you for being here. This is the second year we have had these in our brand spanking new offices. We will have been here 2 years in coming up in January. So it's all fresh and shiny new still. And we love hosting you. My name is Lori Smith. I have been with Area Agency on Aging Akron Canton for about 10 years now. It seems like it's flown by in the blip of an eye. Um, I wanted to welcome you here. A couple of housekeeping notes before we do get fully started. If you need to step out and use the restrooms, they are out of this room just to the left and across the hall. They'll be right there before you get to the lobby area. If you want more coffee, I assume everybody's found that. Please feel free to step out anytime you need to. When we get to Q&A, the questions and answers part of our seminar today, I will bring a mic to you. I know you may not want to speak into a mic, and for that, I apologize profusely, but we do have some Zoom participants joining us today, and that is the only way they can hear us. So everybody wave. There's the camera. Everybody wave to our Zoom people. Hi, we love you. Zoom people, if you would please make sure that your cameras are off and you are muted, and that just helps to keep distractions down for our other Zoom participants. Um, let's see, everybody should have a packet in front of them if you are here with us in person. Inside that folder, you will have information for Advantage plans in Stark and Summit counties. If you need Wayne or Portage, let us know. We can get that to you, no problem. Our virtual participants, if you've not received your packet yet and you requested that it be mailed to you, they are coming soon. I dropped a link in the chat to our website where you can also download and view those materials in the meantime. All right. So I am going to hold you hostage for just a little bit longer. I'm going to share some information about Direction Home, who we are, what we do, other than these fabulous, fabulous seminars. So up here on our screen, you can see that we provide long-term care choices. I'm going to step behind the podium so I can see my notes. We provide long-term care choices for people to live independently in the place that they want to call home. And that is so very important. We don't want to just live, right? We want to thrive. We want to enjoy ourselves. We want to be active. And that is the main goal of Direction Home Area Agency on Aging. We were started in 1965 with the Older Americans Act. We are one of 12 area agencies in Ohio and one of 600 plus area agencies across the nation. So if you know someone who does not live in our service area, Stark, Portage, Summit, and Wayne counties, there is an area agency in that community that can provide services and supports to help you live actively in the place that you want to call home. So who are we in particular, Direction Home? We are a privately held nonprofit that is both a state and nationwide network of aging professionals. And you can see we've got executives with backgrounds in business and law and social work and policy. Our staff is more than 250 wide, primarily social workers and registered nurses. And then of course we have our agency and foundation board of directors. In essence, what we do, we are your front door to simplifying the complexities of long-term care. Any questions you might have about long-term care, give us a call. Even if it's not about our specific programs, we can walk you through any questions you might have. We can help you with what community and government programs might be able to help and how to get help so you or your loved ones can continue to live, again, actively and thriving in your community, and where to learn about program or community options for home-delivered meals, senior housing, transportation, caregiver support, education, and so many more things. We only have so much space and so many slides, so we can do a lot. This is just a snapshot of what we do in a year. More than 12,000 callers have called our Aging and Disability Resource Center, and we've shared information and assistance with them. More than 11,000 Medicare patients avoid hospital readmissions. More than 10,000 people we've assessed in their homes and in the community. More than 8,000 people are care managed for our home and community-based services on our particular programs. And we'll get into that in a second. And then more than 2,300 attendees of continuing education classes and our health and wellness workshops. And I see some of my participants of my health and wellness workshops here today. So thank you. Thank you for following me around. Appreciate that. So you have questions about what we do and how we can help. Where do you start? Every single area agency on aging has an Aging and Disability Resource Center. You'll see that abbreviated ADRC. And I'll pause for a minute here. Again, in your packet, you will see a brochure of ours. And again, you are so handy to steal from. Thank you. So this brochure is what I'm going to be referring to for the next couple of breaths that I take. Everybody should have one of these, or all this information is on our website, dhad.org. But your first steps are you would call the Aging and Disability Resource Center. Again, every single area agency on aging has one of those. That's where you can get connected with our programs and services, ask the questions that you have about long-term care, and receive information and answers to any age-related question. Again, whether it's about our specific programs or just other community resources, we are more than happy to help. Things to absolutely know, it is 100% free to call our ADRC, and anyone can call. You don't have to be an enrollee on our program. You don't have to live in one of these 4 counties. Anyone can call. Referrals for others are accepted. So if you know of a neighbor or somebody that you go to church or whatever with who might benefit from one of our programs, you can refer them. And there are absolutely no obligations. We are not trying to sell you something. We want to help you, right? Okay. These are the things you can call for: program screening and eligibility. So as you're flipping through that brochure and you see our list of programs and you think, hey, yeah, that sounds like something my next door neighbor could benefit from, we can get them screened through those calls. Alzheimer's, dementia, and wellness information, family caregiver support. We've got a great family caregiver program. I saw Teresa, and there she is right in the front. She is fabulous and fantastic. Home and community resources, extra help with Medicare, that's what we're here for today. In-home assessments, and then general information and community resources are all things and more that you can call our Aging and Disability Resource Center representatives. So what is the process? You call. What's that going to look like when I call? So when you connect with one of our representatives, they'll do an initial screening with you. Get a read on the things you want answered, the services you're looking for, what your needs are. And then they can start help identifying long-term care options with you on the phone. And then if you choose and you would like to go further and have an in-home assessment, they will connect you with one of our nurse assessors who will come into your home and get a more in-depth assessment about what your goals are and what things might be a match so we can help you get there. So that's what that initial process looks like. So you've done that, you've done the in-home assessment. Yep, I qualify for Passport. That's where I want to go. So then what? We get you enrolled, and then you are connected with one of our home and community-based service care managers. And that is truly the bulk of our agency. Our most highest populated staff are our care managers. And they help our older adults and people with disabilities accomplish those everyday tasks that we all have to do, like bathing, dressing, getting our meals ready, managing our money. Our care managers oversee all of those processes with the providers that will help you with that. Some of our programs include, and that's in your brochure, there's a lovely chart at the beginning, first few pages of that brochure. But these are some of our programs that we offer: Passport, Assisted Living Waiver, Care Coordination, My Care Ohio, both fully delegated care management and waiver service coordination. And then we have some temporary grant services that as we gain grants, we can add programs on for that grant period. When you open that brochure, you'll see a chart that looks like this, and this is just a snapshot. It tells you the program, who it serves, and what the program offers as far as benefits. So I'll let you do that on your own with that. But please do know, don't self-select out. As you're going through this and you're like, yeah, I might benefit, but I don't check this box. call us anyway. Everything is so individualized that our representatives might see a way to get you connected with a program. And then, again, if it's not ours, we're not just going to dust our hands off and say, lovely talking to you. We are going to connect you with something, some community service that is able to get you where you want to go. So who actually provides the services? If you enroll in Passport, who is actually getting you the meal services? Who is actually providing the transportation? We work with more than 250 contracted providers, including home health agencies, both proprietary and nonprofit, home medical equipment providers, adult daycare providers, home delivered meal providers, assisted living facilities, and more. Okay, so we work with these providers. They contract with us. We have an entire department that makes sure they are dotting all their I's and crossing all their T's. So we know that you are getting the best services possible. Okay. That's all well and good, but what about elder rights? We have a whole department for that as well. And I see Julie also sitting up front. She is our VP of our elder rights department, and a fabulous, neither one of those two knew I was calling them out today. I should have a spotlight. Just like, and it's you. Dim the lights except for the spotlights. So our elder rights department includes our ombudsman, our long-term care ombudsman staff, and they are the complaint investigation and resolution department. They go into long-term care facilities, group homes, and make sure those residents' rights are being upheld. They go to bat for those residents. They also offer information on Medicare benefits, rules and options, and can help with long-term care provider selection assistance. They can, again, talk with you in what you're looking for in a long-term care facility and help you decide if that's the right place for you. So what support is available for family caregivers? Spotlight goes right back to Teresa. She leads support groups both in person and virtually. There is her contact information up there. She is absolutely fabulous. Callie Jobs is also one of our family caregiver support specialists. They also offer free information and assistance. They can offer one-on-one consultations, referrals, and education and planning for our family caregivers, those people who are maybe helping their aging mom or dad with their finances, getting to and from the doctor, helping them around the house, right? It's not our job. We do it because we love them, but it's that informal family caregiving. We have so many things available for them. Opportunities for health and wellness. We are just starting a program called Aging is an Art Form. That is my baby, where we connect older adults with all forms of art. Because one, as we get older, look around you. We are not curled up in a corner being irrelevant. We are still very vibrant and creative, right? Yeah, we are. Yeah, we are. Let's try that again. So we are not curled up in a corner. We are still very lively. Yeah, there it is. There it is. Zoom people, I know I didn't walk around with a microphone, but there was stupendous applause and cheering. We also do continuing education for our licensed professionals, our social workers, nurses, nursing home administrators, so that they can maintain their license. But anyone can attend. If you are curious about one of the topics we're presenting, it's not locked down to those professions. Come on in. We are happy to share the information. And then we also do free, evidence-based health and wellness programming like Tai Chi for arthritis and fall prevention and Bingo Size. They are both falls prevention workshops. And so much, Henry's here, who else is, and Greg's here. Who else is taking these? Yeah, raise your hand. Back there in the corner. Yeah, they're fun, right? Yeah, so yeah, Teresa's saying spotlight on Lori Smith. I coordinate those, I lead them, so come play with me. They're fun. They're a lot of fun. Free. I hold them here. If anybody knows a space in the community, a church, library, any open space, I'm happy to bring these workshops there as well. And they are, did I mention they're free to attend? No? They're free to attend. Direction Home also has a foundation, and we are flipping it can't talk today. We are flipping it on its head. This year, we are focusing on these three things: access to community services, innovation, and investment in the agency. So keep your eyes open. There are going to be lots of new, fantastic things happening with our foundation as we grow and improve it. So I am done talking at you now. This is our contact information up there. If you would like to call the Aging and Disability Resource Center, that is their direct line, 877-770-5558. Or if you want to get a hold of our front desk, the 800-421-7277. And I always like to say the resource center, even though it's an 877 number, when I sit upstairs, I can look over my right shoulder and see our people. So it's an 877 number. We are here in this building. Okay. But now I'm going to turn the mic over to Francine, the main star of the show, who everybody is here to see. I'm done talking at you. You're like, whew, thank God. So thank you, Francine. Come on up. Oh, wait, one more thing. Sorry. I just yanked that mic right back. When we get to the Q&A, I did mention, please remember, I will bring the mic to you for questions. That is truly the only way our Zoom participants can hear the question. And so it's not just one random answer being shared out there and they are like, what? So, and Zoom people, if you have questions, drop them in the chat. Now I give it to Francine.
Thank you, Lori. I hope you enjoyed our agency commercial, and I want to welcome you all here today. How many of you are already on Medicare? Okay. And how many of you have been to one of our presentations before? Okay. All right. So you know that we start out by talking about what is Medicare, because there are some younger folks here that really don't understand what Medicare is. And Medicare is actually national health insurance. It started in 1965. Seems like it's been around longer than that, but it actually didn't start till 1965. It is not income based. Medicaid is income based. Medicare is not. It is, as I said, national health insurance for persons over the age of 65, for people who have been on disability through the Social Security Administration for 24 months, and for persons with end-stage renal disease, a Lou Gehrig's disease, permanent kidney failure, and persons eligible for railroad retirement. So to enroll in Medicare, you can enroll 3 months before your 65th birthday. And this is a good time to enroll because if you do that, your Medicare will begin the first day of the month you turn 65. If you enroll 3 months after your 65th birthday, your Medicare will begin the month after you enroll. If you are receiving a Social Security check, the Social Security Administration will automatically send you a red, white, and blue card. And it is also automatic for people under age 65, again, who have been disabled for 24 months. If you miss your initial Medicare enrollment, and I hope nobody who's not on Medicare yet does this, you do have the opportunity to enroll between January 1st and March 31st. In that event, your coverage will begin the following month after your enrollment. You used to have to wait till July 1st if you missed it, but now they have changed that and it will begin the following month after enrollment. There are some special enrollment periods. So, if people are impacted by an emergency or disaster, and we've seen a few of those this year in some states, they will have a special enrollment period. If you move into or leave a nursing home, you have a special enrollment period. If your health plan or employer makes an error or you lose coverage, you also have a special enrollment period. And if you lose Medicaid, which some people are likely to do in 2026, they will have a special enrollment period for Medicare. We do these sessions now because it is Medicare open enrollment. So you have the opportunity during Medicare open enrollment, if you're already on Medicare, to look at your coverage and change it if you need to. Check your coverage now. If you're in a Medicare Advantage plan, you should have received an annual notice of change telling you what changes have been made to your Medicare plan. This includes all Medicare beneficiaries, even those who have Medicare also. So there are two kinds of coverage with Medicare. And for those of you that have heard me speak before, you probably know, and if you don't remember, I'm going to repeat myself. There are two kinds of coverage. One is traditional Medicare, and that's where you use your red, white, and blue card when you go to the doctor or any other medical provider. The other type of coverage, which is the other type of Medicare coverage, is to join a Medicare Advantage plan. And if you do that, you receive a card through that plan, and you will use that card when you seek medical care. There are advantages and disadvantages to both types of coverage. The advantages to traditional Medicare is that you can go to any provider in the United States that takes Medicare. Traditionally, there have been no prior authorizations. That is changing, and I'll mention that again a little bit later. There is a pilot program in 6 states that will cause prior authorizations for certain services, and those will include nerve stimulators, epidural, steroid injections, spinal infusions, knee arthroscopy, and skin substitutes. Unfortunately, Ohio is one of those that will have those prior authorizations. Now, with traditional or original Medicare, you can also add what we call supplemental insurance or Medigap insurance. And I'll be talking more about that in a little bit. And again, there are no geographic restrictions. You can go to any provider you choose. The disadvantages are that there are no extra benefits. So no vision, no hearing, no dental. There are no out-of-pocket limitations to what you spend on your medical care. And typically, if you don't have insurance through the VA or a creditable retirement plan, you have to choose a separate Part D plan, which again, I will address a little later on. And supplemental coverage can become expensive, especially as you age. Now, Medicare Advantage plans have extra benefits. They have cash cards. They all cover hearing, dental, and vision. Many of them have low monthly premiums, but you have to still pay for your Part B. There are also out-of-pocket limits. Most of them include your drug coverage. You don't have to have a separate drug plan. And they must cover everything that traditional Medicare covers. However, you have to typically use most of the time, not all the time, but most of the time, you have to use their doctors and their hospitals, and there may be geographic restrictions if the plan you choose is not a national plan. Now, they all have to cover you in an emergency, no matter where you are in the United States, but some of them that are not national plans, they can cover you for an emergency, but not beyond that. They also have many prior authorizations. And as I mentioned, provider restrictions, you have to use their doctors, their hospitals, any kind of medical provider. And you can't add any supplemental insurance to cover your copays. So I'm going to go over now, what does traditional Medicare Part A cover? And as I mentioned, Medicare Advantage plans have to cover the same things that traditional Medicare covers. So Part A covers blood, home health care services, hospice care, inpatient hospital care, and skilled nursing care. So when we're talking about hospital coverage, the reason the top of this slide says 2005 is because the numbers for 2006 have not been reported yet. Typically, they aren't reported until usually the first week in November. If there's an election, they often wait till the day after the election to report it. But I do have some projections. So Part A has no premium for most people. Why? Because most people, either you or your spouse has worked full-time for 10 years. and you've already paid into the system. Now, if you haven't worked full time for 10 years or your spouse hasn't, there is a premium for Part A, but most people don't have one. This year, the hospital deductible, so when you entered the hospital, you had a deductible of $1,676. Next year, it is projected that that deductible will go up to $1,716. So then you're covered for 60 days. After 60 days, and let's face it, it's rare that a person stays in the hospital that long. But if that happens, you have a daily coinsurance, which is this year $419, and next year likely about $429. And then if you become seriously ill and are in the hospital for a long time, you can use your lifetime reserve days, but you can only use those once. And that will cover you from days 91 to up to 150 days at a coinsurance daily rate of $838. And that again is projected to increase to $858 next year. Part A also covers skilled care in a nursing home. Now, what do we mean by skilled care? It's not custodial care. Medicare doesn't cover nursing home care if you're just there because you need help dressing, you need help eating, you need help walking. Medicare only covers skilled care, and that means physical therapy, occupational therapy, and speech therapy. Or if your conditions are so medically complex that a doctor orders that an RN monitor you on a daily basis. Under traditional Medicare, you need a 3-day hospital stay before traditional Medicare will cover you. That does not include the day of discharge. So let's say 4 days. Not only that, observation status does not count. So if you're in the hospital and you're on observation status, it will not count towards those 3 days. Then you're covered in full for 20 days. And after day 20, you have a daily coinsurance payment that is due. This year it was $204. Next year it is projected to be $214.50. And the benefit can last for 100 days. But I have to tell you, it is very rare that a person is skilled for 100 days. So a lot of times I'll get a call from somebody and they'll say, my mom's in the nursing home and they've cut her therapy, but she's covered for 100 days. Not necessarily. That's not a guarantee. There are certain criteria that have to be met for coverage to continue. However, once a person leaves the nursing home, and if they don't receive skilled care in a nursing home or hospital for 60 days, a whole new benefit starts over. You have the right to appeal any cut in skilled therapy. And if you've ever been in a skilled facility after a knee replacement or some other kind of surgery and you're in therapy, if your therapy was cut, you do have the right to appeal. The main questions to be answered for skilled care are, can the care be safe and effective without the involvement of skilled professionals? Who are the skilled professionals? They're the physical therapists, the occupational therapists, the speech therapists, and the RNs. And are skilled services needed to maintain or slow your decline? That's a tough one to prove. And there was a lawsuit, Jimmo versus the Health and Human Services Director at the time, who I think it was Jimmo versus Sebelius. And that lawsuit was won, but it's still very hard to get the insurance companies to approve any services that you need to maintain or slow your decline. Part A also covers hospice care. So hospice care is comfort care, not curative treatment. It also covers services for pain relief and pain management. If you're at home, it can cover aid and homemaker services, spiritual and grief counseling. It does not cover room and board if a person is in the nursing home. It will cover the hospice services I just mentioned, but not room and board. And if a person is home under hospice, and let's say their family is helping to care for them, and the family needs a break, and they go into the facility for what we call respite care, that means they're there for just a short time. Maybe the family needs to go on vacation or just needs a break from caregiving. They would have a 5% copayment for inpatient respite care. Home health care, it's intermittent skilled care. So again, we're talking skilled care, a nurse coming into your house to monitor you. It's not forever. It can include aid services, but I will tell you from what I understand, getting aid services is very limited right now. You must be what they call homebound. That doesn't mean that you can't leave your house. What it means is to leave your house requires a lot of effort, okay? It's not that you're in bed and can't move. You have to have a face-to-face visit with your doctor, and your doctor has to develop a care plan. And these services can also include social services. So a social worker may be coming to your home. So that's part A. Now we're going to talk about part B, which is your medical insurance. And it covers doctor visits, preventive care and vaccines, durable medical equipment. What's that? Wheelchairs, walkers, things of that sort. Covers ambulance services. And if you need a medication administered in a doctor's office, it will cover that too. Again, we don't have the 2026 numbers for Medicare Part B yet, and I'm not sure we'll get them unless Congress goes back into session and the government reopens. But here are their projections, give you some idea. This year, everybody has a premium for Part B. This year, the premium was $185 a month. Next year, it is anticipated that the premium will be $206.50. Now, this is somewhat tied to the cost of living adjustment. So, the cost of living adjustment I've read is supposedly going to be announced tomorrow. But professionals are projecting that it will be anywhere from 2.5% to 2.8% increase in your Social Security check. A lot of people are saying it's going to be 2.7%. The yearly deductible. So every year, when you go to your doctor's office or you need another service covered by Part B, you have to meet this deductible before Part B kicks in. And this year it was $257. Next year it's going to be $288 projected. After that, you still have a 20% Medicare approved amount copay. Now, notice I say Medicare approved amount. So I always give the example of you go to the doctor charges $100 for the visit, Medicare pays the doctor $60. What do you owe? You owe 20% of 60, so you owe $12. The remainder of the amount that the doctor charges in the state of Ohio goes away because we have what's called a no balance billing law in the state of Ohio. Part B also covers observation status in the hospital. So Part A doesn't cover that. So if you go into the hospital, you're going to have your 20% copayment, and you'll have to have met your yearly deductible. Part B and D, both of them are income adjusted. So that premium of $185 is higher for those individuals who are fortunate enough to make over the amounts listed that you see. And those can change every year. And the higher your income, the more you pay. I mentioned that the Part B is somewhat tied to the cost of living adjustment. And this is what's called the hold harmless provision. So what the hold harmless provision does is it prevents Social Security payments from being reduced if the Part B premium exceeds the increase, your increase in your Social Security check. So you're held harmless. We don't anticipate that that's going to happen in 2026, but be aware that it can. So Social Security benefit increase covers the increase in Part B premium, then you pay the new amount. If it doesn't cover the increase in the Part B premium amount, you will not pay the full amount. To be held harmless, you have to have received Social Security and paid premiums in both November and December of the previous year. And the premium must have been deducted from your Social Security benefit, which most people do. Now, some people can delay their Part B. I get a lot of questions about this. People call me and they'll say, I'm still working and I have health insurance through my employer. Do I have to sign up for Medicare? Well, the answer is no. Some people go ahead and sign up for Part A. You don't have to, but please note that you can delay your Part B. If you or your spouse has medical insurance that is considered primary to Medicare through a current employer, you can tell the Social Security Administration that you don't want to sign up for Part B yet, but you have to tell them. Now, if for some reason you end up being covered by COBRA because of loss or you lose your employer coverage, COBRA, if people choose to be covered by COBRA, that can last up to 6 months, but you still have to enroll in Medicare Part B within 8 months. If you don't enroll in Part B when you're supposed to enroll in Part B, you will have a late enrollment penalty of 10% of the premium for each month you were eligible and did not enroll. So you always want to make sure you enroll in Part B on time. So if you delayed Part B and you're going to retire and you're going to lose your health insurance through your employer, you want to let Social Security know ahead of time and tell them when you want your Part B to start. So as you can see, Medicare has some out-of-pocket costs that many people who are not in Medicare realize. Because of that, if someone chooses traditional Medicare, and this is only for traditional Medicare, they can add what's called supplemental or Medigap insurance. And in your packets, you have a chart that looks like this. Okay. These are Medigap or supplemental insurance plans. To get them in Ohio, you have to be 65 and have both Parts A and Part B. What you need to know is the premiums vary by company and coverage. Now, what I mean by that, all of these plans in every state cover the same thing. So in Ohio, California, all over the United States, these plans cover the same thing. They're standardized. But like when you buy house insurance or car insurance for the same type of coverage, you look at different companies because you might be paying $160 a month for your car insurance by one company. With the same coverage in another company, you might be paying $75 a month. So the same holds true for these Medigap plans. Please note that Parts C and F are only available to those eligible for Medicare and who signed up for Medicare before January 1st, 2020. The best time to buy Medigap or supplemental insurance is during the first 6 months you have Parts A and B and you're 65. At this time, you have what's called a guaranteed issuance right. And what that means is whatever Medigap plan you pick has to cover you regardless of any pre-existing conditions. After that point, you may still be able to get Medigap insurance, but they can ask you about your health and you may be charged more for the insurance. Also note that Medigap plans do not cover prescriptions, dental, vision, or long-term care, but some of them and some companies do offer silver sneakers So that may be another thing that you want to look at. You get a free gym membership through some. There are different ways that Medigap plans charge people. So you always want to ask these questions. There's the community rating, and that's when all policyholders are charged the same premium without regard to their age. If raised, so if the premium's raised for one person, it's raised for everybody. There's also what's called issue age. And this is where they can base premiums based on your age at the time of purchase, but cannot raise premium based on age later. They can base their premiums on other factors. And then there's attained age. And a lot of these plans are attained age, and that's where they can vary premiums based on age. They can increase your premium based on age and on other factors going on with the insurers. So ask that question. For those people who have limited income and assets, there are programs called Medicare savings programs. And in your packet, you have additional information on these programs and the eligibility. So there are different kinds. Qualified QMB, qualified Medicare beneficiary, will pay both Part A and Part B premiums, all a person's copays and their deductibles. Anybody who is on Medicaid is automatically QMB. There is SLMB, and that will pay your Part B premium. And QI, and that's usually limited to only a certain number of individuals each year in the state. That also can cover your Part B premium. And then there's QDWI. It pays the Part A premiums for those under 65 with disabilities who are on Medicare. You can apply for these benefits at your local county job and family services, or you can call us and ask for our Aging Resource Center, and they can assist you further. We'll move on now to Medicare prescription drug plans. There are two ways to get prescription drug coverage in Medicare. So one is if you have the traditional Medicare that we talked about, you have to get a separate drug policy unless you have creditable coverage through a retirement plan, a previous employer, or if you get coverage through the VA. VA coverage is considered creditable. And that's these plans with the green at the top. Those are standalone prescription drug plans. You need to make sure you sign up for Medicare Part D when you're first eligible, or again, you will face a lifetime penalty. So, and I say this every year too. People will say, well, I don't take drugs. Why do I have to sign up? Well, you're risking some things there because you can't sign up in the middle of the year. So if you get sick in the middle of the year, you can't get Part D. You have to wait till open enrollment, and then you won't have coverage until January 1st of the following year. And that lifetime penalty is 1% of the national base premium for every month you were eligible and did not enroll. So make sure, again, that you enroll in Part D when you are eligible. And if you want to argue with me about that, all I'll say to you is you have car insurance in case you get in an accident, right? You have homeowner's insurance in case your house burns down, right? Same reason you need Part D. Every year, the standard benefit for Part D changes. So this year, there was the standard benefit is it tells plans what they can and cannot do. So this year, plans were not allowed to have a deductible of more than $590 per year. Well, that's gone up, and these are real numbers for 2026. That's gone up to $615 for 2026. So plans are allowed to have a deductible as high as $615, but no higher. They can have a lower deductible, but they can't go any higher. Then, as you all may be aware, that infamous donut hole has gone away. So now there's an initial coverage limit. So you're going to pay, so after you meet the deductible, if there is one, you're going to pay your prescription costs up to $2,100 per year. And then once you hit that, you don't pay anything. You're considered to have catastrophic coverage. So that was up from 2025 too. It's actually $100, not $200. In addition, you can now spread the cost of your prescriptions over 12 months and be billed by your plan. Of course, you must inform them that you want to do that. And the $35 cap on insulin costs, there's no deductible for insulin costs. You don't have to meet a deductible. There was a 35 cap put on that last year, and that remains for 2026. When I looked at standalone plans, and that's those plans with that green banner, I saw some reductions in premiums, but most of them have that high deductible of $615. So that's a big increase in the deductible. There's also a significant reduction in the number of plans. And this is occurring across the United States, not just in Ohio. So what you're looking at is Ohio plans. Last year, I believe we had 22 plans. This year we have 10. And only 3 of those plans will serve people who qualify for what we call extra help. So when you're looking at Part D, you want to look at, of course, are my prescriptions covered and how much are they going to cost me? You also want to look at the restrictions. So is there prior authorization requirement? Because that means you might need to do that before January hits. Are there quantity limits? And is there step therapy? And step therapy is when the plan wants you to take a cheaper drug before you try the more expensive one. So you want to look at that. Now, if you have, let's say you need an expensive drug and you've already tried the less expensive alternatives, your doctor can appeal that and tell them that you've already tried X, Y, and Z medication. They're not working, so you need the more expensive drug. But all Part D appeals need to go through your physician. You also want to look at the pharmacy network. So if we'll talk about the plan selection in the Medicare website, but they do ask you what's your favorite pharmacy, and there's a reason for that. Most pharmacies take all 10 Part D plans and most Medicare Advantage Part D. But you want to ask if they are an in-network pharmacy because you're getting a cheaper rate if you go to an in-network pharmacy. So you might like CVS, and you might say to the pharmacist, do you take my plan XYZ? Oh yeah, we take all the plans. Wrong question. Are you in network with my plan XYZ? And they might say, no, I'm sorry, I'm not. So then you have to go to an in-network pharmacy. And then you want to look at the star ratings. And unfortunately, with those standalone plans, I was a little dismayed by some of those star ratings. I'll look at them again. So you don't want to pick one that's below 3.0. We have several 3.0s, we have a couple 3.5s, but again, you need to look at all these other factors too. So you need to weigh all these factors. Star ratings are based on member complaints, the number of people who left the plan last year, if they provide their members with accurate drug pricing, the ease of filling prescriptions, and then any changes to the plan that happen mid-year. So that's what those star ratings are about. Just as I mentioned the Medicare savings plans, there is also extra help for people with their prescription drug insurance. Last year, it was expanded to 150% of the poverty level. It will remain that in 2026. This is where if somebody qualifies, they don't have to pay a premium or a deductible in plans with premiums in Ohio less than $39.30. They also will have reduced copays for generic drug and brand name reduced costs for generic and brand name drugs, and many of the generics may have a zero copay. You can apply for this extra help by visiting the Social Security website. I don't know if it's up and going right now. I didn't try, but normally you can. Or you can call Direction Home and they will assist you in applying for extra help. I can't emphasize this enough. Is there's one thing you want to check every year, it's your prescription costs. You can do that by going to the Medicare website that I have listed up there in the purple box. You can call Medicare, although I've gotten different reactions to that one from people. Or you can call the Ohio Seniors Health Insurance Information Program, OSHIP, and they will assist you in doing the analysis. It's not that hard to do if you use a computer. You can have a family member do it if you don't want to do it. You go into the website, you click on look at plans, and it'll ask you to put your medications in with the dosages and how many times a day you take them. It'll ask you if you get extra help. It'll ask you if you get Medicaid. And it'll ask you what your favorite pharmacies are. And then it'll take all that information and it will give you a list of plans, whether it be, you can choose standalone Part D, you can choose Medicare Advantage plans. Sometimes it's good to compare both ways. And it'll give you a list of plans in order of cost effectiveness for you. And then if you click on that plan, you can go to, it'll give you additional information, more than cost information. So it's a handy website to use. So we talked about traditional Medicare. Now we're going to talk about Medicare Advantage plans, or sometimes known as Part C. To join a Medicare Advantage plan, you have to have Parts A and B. Most of these plans include drug coverage, but there are a few who do not. And if they don't include drug coverage, you need to add a standalone plan. As I mentioned before, one of the advantages of these plans are that they have out-of-pocket maximums. Many have zero premiums. Most, or if not all, do not require a 3-day hospital stay for rehab. But there are provider limitations that often apply. So you had a chart in your packet, probably for Summit County. Maybe some of you asked for Stark, or we cover 4 counties. So I do them all for all counties. And what this tells you is the star ratings, the monthly premiums, what the drug deductible is. Most of them have zero copays for your primary care physicians. I will tell you that if you see a lot of specialists, costs for specialists can range anywhere from $25 to $45 a visit. So you want to look more in depth at the plan coverage. HMO, POS, means Health Maintenance Organization Point of Service. Typically, that means to go out of network, your primary care physician has to refer you and you may be charged more. PPO, Preferred Provider Organization, does allow you to go out of network, but again, you may be charged more. And you'll notice that the maximum out-of-pocket limits vary if you're out of network. So one thing you want to look at when you're looking at these plans is if you have high medical costs, you want to look at that out-of-pocket maximum because that's going to matter to you. If you see a lot of specialists, you might want to look at what they charge for specialists. You want to look at the star ratings too. So Medicare Advantage plans are not, these plans are not supplemental plans. People keep telling me I have a supplemental plan. So then I say, what card, do you use your red, white, and blue card when you go to the doctor? No, I use my Anthem card. You don't have a supplemental plan. Anthem does sell Medigap plans, but if you're using a card with an RX on it or just that card for your medical appointments, you're in a Medicare Advantage plan. They contract with the federal government. It's just another form of Medicare. You're not allowed to purchase a supplement if you're in a Medicare Advantage plan. And if you join a Medicare Advantage plan, you can switch to another Medicare Advantage plan or go back to traditional Medicare every year between January 1st and March 31st. And that's only for people in Medicare Advantage plans. They offer all these additional benefits. Cash cards, that's become a big thing. Telehealth, fitness benefit. They all offer dental, hearing, and vision. Some offer meals for home health care, but that's been limited this year. Only a few of those actually offer those. So some of these benefits have been reduced. If you're in a Medicare Advantage plan, you should have already received a letter in the mail at the beginning of October, beginning of this month, telling you what changed in the plan you have. So you want to make sure you look carefully at those letters instead of saying, oh gosh, I don't want to read this. You know, we get so sick of it, it's like throw it away. Again, you're looking at cost, focus on the services you need most. As I mentioned, if you go to specialists, if you know you're going to be in the hospital. Hospital coverage varies with these plans. Usually it's days 1 through 5, you're going to pay this amount. After day 5, you're going to pay more. So you want to look at the services that you're going to use. You want to look at if they have prescription drug coverage, which most do. You'll find on the chart in the back, the last page or so of those charts, that's a list of plans that don't include drug coverage. So we kind of split them out for you. So you want to make sure your prescriptions are covered. You want to look at any extra services that you want. And for those companies like Humana, which drives me crazy every year when I do these charts, because they have like 19 plans and they're all called the same thing. And so I'm like hitting my head against the wall for an hour looking at those. There might be subtle differences between coverage of those plans. And of course, look at the star ratings. We have no 5-star plans in our 4-county area. We do have some plans with 4.5 stars, many plans with 3.5 stars. And then the other thing to look at is the plan reputation. So I got a call yesterday, and this woman said to me, she said, you know, I'm in a Medicare Advantage plan, and I think I want to change. So I walked her through the Medicare website, and I also gave her OSHIP's number in case she needed additional information that wasn't in there. But I said to her, and she goes, but I really like my doctor. And I said, well, call your doctor's office and ask them which plans they're going to take in 2026. And she said, oh, can I do that? I said, yeah, they'll know now which plans they're going to take. I said, but then also ask them which plans are easier to work with, because they know which plans require more prior authorizations than other plans, which plans deny more often than other plans. So you can ask them that. For God's sakes, don't ask your neighbors. You don't want the same thing as your neighbors. This is all individualized. So, and she said to me, she goes, my neighbor told me, she said that I need to do this, that, and the other thing. Then I got another caller yesterday, and she said, my neighbor told me to drop my supplement and go on a Medicare Advantage plan. Well, I had a lot of serious questions to ask her about her what medical care she needs, if she's ill, blah, 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 blah. So that too is an individualized choice, and it's based on a lot of factors. So we had a good conversation about that, and I told her to stop talking to her friends. So Medicare Advantage plans, like the Part D plans, have star ratings, and these are some of the things that those star ratings are based on. Preventative measures used by members. So how many women got mammograms? How many people had colonoscopies? So they look at health screenings and they look at vaccinations. They also look at member complaints. They look at how many times their decisions have been appealed, how many members chose to leave, and if they actually provided important information to their members. So what was their communication like throughout the year? When I look at local changes to our Medicare Advantage plans, our premiums remained relatively stable. Unlike other parts of the countries where some of these organizations are pulling out, we have numerous choices in our 4 counties. So the number of choices remain. However, there is a significant increase in out-of-pocket limits in some plans. So again, if you utilize a lot of medical care, you need to look at that. I also saw a significant increase in drug deductibles. So many of those plans hiked their drug deductible up to $615. They may have lowered their premium, but then they hiked the drug deductible up. And I've been told that some extra benefits have been reduced. I don't look so much at those, but you should have, as I mentioned, you should have gotten a letter that informed you of any changes to your Medicare Advantage plan. There are also Medicare Advantage plans that are a little bit different, and they're called special needs plans. And these are for people with chronic conditions, people in nursing homes, people that have both Medicare and Medicaid. Some of them do have premiums. Some have medical and drug deductibles. The benefits vary and should be compared to other choices. So if you're looking at one of these special needs plans, you still want to compare them to other choices, especially if you are a dual and you're in a program called MyCare Ohio. So in 2026, MyCare Ohio now becomes MyCare Ohio Next Generation. MyCare Ohio started in 2014, and it's for Ohioans who had both Medicare and Medicaid. So you can have both, because remember what I told you. Medicare is automatic for people who are eligible. Medicaid is based on need. The initial rollout of the new MyCare Ohio will be January 1st in counties where MyCare is currently available. For anybody here that's on MyCare, you should have received a letter from the state either recently or you will be getting it soon. There will also be a statewide expansion in April through August of next year. So people that have MyCare Ohio will have a choice to choose their Medicaid through Anthem, CareSource, or Molina. I left out Buckeye because Buckeye's allowed to keep those enrolled already in their plan, but they're not allowed to have new enrollees. So they can choose their Medicaid through those plans, but they can also choose to have their Medicare through that plan. So they can combine the two. So as I mentioned, letters to current enrollees should be in the mail if you haven't gotten it already. If you have questions, individuals can contact the Medicaid hotline at 1-800-324-8680. So to analyze your cost and coverage, again, you have these 3 options. You can go to the Medicare website, you can call OSHIP, or you can call Medicare. OSHIP volunteers are wonderful, and they have trained counselors that are great. So switching plans, you can only switch plans at certain times of the year. You can do it now. You can switch also, if you're in a Medicare Advantage plan, you can switch between January and March. But if you are, next year, if you are a person who has Medicare and Medicaid, you can switch your plans monthly. I want to talk a little bit about marketing guidelines. Brokers are not allowed to provide misleading information or use high pressure tactics of any kind. Marketing guidelines prohibit unsolicited contact by phone, text, or email. And I know people are getting calls. Now, you are allowed to get a call from the company, if you're in a plan, from the company that has that plan. So if you have an AARP plan, you're allowed to get a call from United. But you're really not supposed to get a phone call from anybody else. So what do you do when they say, "Hi, I'm calling about Medicare"? Hang up immediately. And never, ever answer any questions. And don't give your Medicare information to anyone. Door-to-door solicitation is also prohibited. And brokers are supposed to inform you of all the plans they represent. So brokers, it's good to go through a broker. They have information that can be very helpful to you, but not all brokers represent all plans. So you want to find, they're supposed to tell you which plans they represent. If they don't, you can ask them. And then if you're talking with a broker and you decide to change your coverage next year, they're supposed to explain to you the effect on your current coverage, the effect on your doctors, your pharmacies, your medications, and your costs. When you're in Medicare and you are denied services, as an ombudsman, I want to tell you that you have the right to appeal. You can appeal coverage and payment denials for any covered service. The appeal process is a little bit different for Medicare Advantage plans and traditional Medicare, but only the first couple of steps. As I mentioned, any appeals for prescriptions must go through your doctor. Know that prior authorizations are now monitored, and you can appeal those too. And then there are now appeal steps for observation status. But that's only if your status was changed. Let's say you were told you were an inpatient in the hospital, and then you find out that your status was changed. You get a letter in the mail that says, "Oh, you owe us hundreds of thousands of dollars for your stay in the hospital." They changed your status to observation status. You can appeal that now. In other news, some of it good, some of it not so good. Supplemental benefits, those extra benefits that Medicare Advantage plans offer, they have to send you a notice mid-year telling you what benefits you haven't used. Because there was a study done, and what they found is a lot of people don't use those extra benefits, even the cash cards. They might not even know that they're available. Maybe they didn't get one in the mail. So now they have to tell you mid-year what you didn't use. If you are on Medicare and you made an account on the Medicare website, you need to put in an email address. So they now require email addresses. Social Security isn't going to send paper checks anymore. They started that at the end of September. And then I mentioned it's called the WISER demonstration. It's supposed to cut down on waste and abuse and all that stuff. And it affects 6 states. And so people who are on traditional Medicare never had to go through prior authorization for any service. In these 6 states, including Ohio, they will now have prior authorization through for some services. There's a 5-year plan in the works to cover those weight loss drugs. This 5-year plan supposedly would allow state Medicaid and Medicare Advantage plans to cover them voluntarily. So I don't know what that means because as you see, they're very expensive. This would begin in April 2026. The hurdle in the United States is the cost. So you see the difference there. If we compare it to Japan, what people pay and what we pay per month, there's a huge difference. Medicare can now cover some of those, but coverage is limited to those with diabetes or heart disease. And this proposal is not yet final. Every year I look at the Medicare trustees report, so it's always like 1 year back. The Hospital Insurance Trust Fund will become, they're forecasting that it may become insolvent in 2033, causing payments to be cut. So if payments are cut to providers like doctors and hospitals, that's not a good thing. Parts B and D remain financed adequately because we pay for them. We pay premiums for them. Just to give you an idea of what's spent on Medicare, in 2024, over $1 billion was spent, and it represented almost 4% of the gross national product and 14% of the federal budget in 2024. So I don't want to end on a bad note. What I want to say about that is we have to pay attention to what our legislatures do because there are options rolling around. They know something has to be done with Medicare. So you want to make sure you know where your legislators stand in terms of what actions they think need to be taken. Do they believe benefits should be cut? Do they believe payments to Medicare Advantage plans should be reduced? Because Medicare Advantage plans cost the government, there's overpayments to them, and they cost the government much more than traditional Medicare. So you want to find out what do they believe, and then you figure out what you think the steps should be, and then you cast your ballot based on your beliefs. So that's why I put that slide up there. I want everybody to pay attention. And that goes for not just people on Medicare right now. That goes for younger people too. We need to pay attention. We need to pay attention what they're going to do with Medicare. We need to pay attention what they're going to do with Social Security. So ask questions, and then you'll know how you feel about whoever. All right. Now, I'm willing to take questions from the audience.
Please hold. Oh, there we go. Okay, I will start back here.
Do it cost to go with a broker?
Does it cost what?
Go with a broker.
No. Typically, they might be paid by the plans they represent. It does
And-
not cost to go with a broker.
Okay, and as a reminder to our friends on Zoom, if you have a question, go ahead and type it into the chat window, and I will read them to Francine for your answer.
A couple of weeks ago, I went down to the art museum for the health fair,
Uh-huh.
and I was introduced to a company down there called McGregor Pace. I understand that, and I got the Medicare booklet in the mail.
Yeah.
And on the back, it talks about Pace plans in Ohio.
Yes.
This is totally new to me. Can you explain it?
I'm not prepared to go into deeply what PACE is. PACE is an alternative for some people on Medicare. When you go, I can tell you that when you go into PACE, they will take care of all of your care. I'm sorry? I don't know the answer to that. If it deletes waiver services. See, yeah, call the Aging Resource Center because PACE just started in our county. So it's new to us. I did visit the site. It's at Rocky Knoll. But I don't know enough about it to be able to answer those questions.
Yes, I'm in a plan that covers all my doctors and I've been quite satisfied with it. One of the main doctors, from what I've been able to find out, although he doesn't know and his office can't confirm it, is not going to be in it in 26. Is there terminology or some kind of approach that I can take with this doctor and create a separate arrangement so I'll pay him even though he's out of network?
It depends. If you're on Medicaid, the answer is likely no. Okay.
No, I'm not on Medicaid.
You would have to ask the doctor.
Okay.
Yeah, that's up to the doctor.
I'm gonna hop over to this side of the room. And I'm sorry, was it you? Okay.
Right. Excuse me. Right now I have a Plan F with a company
Okay.
and the premiums are pretty high.
Yes, they are.
Can I shop around and still get that with a different company since they no longer offer a Plan F?
You can, but you can be asked questions about any previous conditions you have, and you could be charged more.
Okay. That answers that question.
Anybody? Oh, I thought you had another question. Any questions over here? I am getting my steps today. I'm here for it. Kind of.
Thank you. It's not a question. I just wanted to make a comment about a new program through traditional Medicare that is helpful to caregivers. So if your care recipient, the person that you're caring for, has a diagnosis of dementia and they are on traditional Medicare, not an Advantage plan, there is a new program that will pay up to $2,500 for respite time for that person. And it could be in the home or it could be in a facility. So I just wanted to throw that out and make sure everybody was aware of that. If you have questions, contact Teresa here, Direction Home, Family Caregiver Support.
Thank you, Teresa.
Anybody come to the back?
Does Medicare pay for televisits with your doctor rather than face-to-face?
It did, but it's my understanding that that is on hold right now.
All right.
Go ahead and pass it right on down. Go ahead.
I have a question. I'm in my window to apply for Medicare for the first time, but I plan on working until I'm 67. So my question is though, if my employer, I work full time, if my employer has more than 20 employees, they have to keep covering me at my current insurance, just like as long as I maintain my.
No, they don't.
I thought if they had more than 20 people.
If they have more than 20 employees, your insurance is creditable with Medicare. But I'll give you an example. My sister worked for a group of attorneys in Stark County. And once she turned 65, her insurance stopped through them and she had to go on Medicare. So they do not have to cover you.
Can they if they want to?
If they want to, they can.
So if they tell me here in a couple of weeks, they can cut me off then?
Yeah. Well, they're going to give you a chance to enroll
Well,
in
yeah.
Medicare. So you need to talk to somebody as soon as you can.
And then the other question, I went online half-heartedly to start this process to enroll. But
Okay.
the one of the questions was, are you applying for 2025 or 2026? I'm like, well, I'll be 65 in 2025, but it's the end of the year. So what was the answer to that? That was the
When are you
question.
turning 65?
December 7th.
Okay, if you apply now, your Medicare will be effective December 1st.
So say 2025 then?
Yes,
Okay, thanks.
you're welcome.
Oh. All right. Any other questions in the room up here?
Good morning. My wife and I are going to begin our Medicare for next year. And we got in with a broker. Now from what I hear you say is not all brokers are made the same. Is there any other avenue we could go, or how do you check out your broker?
You can call OSHIP and have them do an analysis and compare it to what your broker says, or go online yourself. But generally, I mean, there's nothing bad about brokers.
You said that if they covered it or represented it all, or
Well, they
every
may not
plan.
represent all plans,
Yeah.
but they can be very helpful in telling you about, the nitty gritty of coverage in the plans.
Any other questions in the room?
Over
Okay,
here.
over. Y'all are making me work for it. Okay. As I stroll over there, also a reminder that we are recording these sessions, and one of the three that we're doing will be posted to our website, that is dhad.org. If you go to the education tab, you'll see Medicare education. Go there. It's where you find the schedule of our events, what these are about, and then all the packet materials are also there, and then a recording of one of these three sessions will be there.
What exactly is the out-of-pocket? I was told that co-pays, drugs and all that is, but I'm not sure on the Medicare Advantage. Right now, we have a supplement.
Okay. Typically on Medicare Advantage, and some plans, your drugs will not be covered, are not part of that. So it's just medical expenses.
Okay, so if you have, we have dental coverage with the state.
Mm-hmm.
If you take a Medicare Advantage plan, can you keep it, or would your Medicare Advantage plan say, no, you can't have another one?
Well, I guess you could, but you're kind of paying double.
Okay, because some covered 2,000, I was looking.
Right, right.
Like,
You have to look at that dental coverage closely, and the vision too,
Okay.
because it can be limited. And sometimes to get extended coverage in those areas, you have to pay an extra premium.
In Medicare Advantage?
Mm-hmm.
Oh, and they should tell you that when you go to sign up.
Yes, yes.
For one. Okay. Let me see something else. I have another question.
I mean, you don't have to use a benefit if you don't want to. Sometimes you may not want to use your Part D plan because the amount you pay for your prescription is more than if you go to Walmart and get a generic.
Right.
So
Another thing I wanted to know is our Medicare supplement renews December 1st. And they've upped the rate, of course. So Medicare Advantage, if we apply for one, it won't start till January 1st.
correct,
So you'd still pay the price of
correct. You would
December.
pay for December, but not January.
Over here. We'll go to you and then you.
I've had the same plan for about 5 years. And I've noticed this year, under doctor's choice, it says no. Does that mean that my doctor is not covered?
If it's no, it means that you have to see if your doctor is in network.
Still, I just give him a call.
Yeah.
And still, if he's,
Yeah.
okay, thank you.
Did I misunderstand that your drugs are not, your Medicaid, the payments you make for your drugs does not count against your deductible? Did I misunderstand that?
No. She's talking about the out-of-pocket limit. The out-of-pocket limits on the Medicare Advantage plan typically do not include drug costs. So if you look at the chart, that last column that you're looking at, this chart,
Yeah,
okay, last column,
of that out of pocket. Okay.
your drug costs wouldn't be counted towards that, just your
no.
medical expenses.
Okay, that's medical. Okay.
Yeah,
Now, another thing.
it's okay.
Sorry. If someone has been in an Advantage plan, like my husband was covered under me when I worked, but I switched him to original Medicare. Now, if he goes to an Advantage plan now,
Mm-hmm.
does that mean he can never go back to original Medicare because he was
No.
covered under me years ago?
No. Medicare, traditional Medicare and Medicare Advantage are both Medicare, and you can switch back and forth every year during this time, open enrollment, October 15th through December 7th.
Well, I was under the impression if you were in an Advantage plan and you want to go to traditional Medicare, if you had been in an Advantage plan before, you cannot change, is what they're
No.
telling me.
You can change every
stuck.
year during open enrollment.
Go back to
And if you're in
original.
a Medicare Advantage plan and you decide you don't like it and you want to go back to traditional Medicare, you can do it between January 1st and March 31st of every year. No, Medicare doesn't, only private insurance can do that, not Medicare. Yeah, supplements are private insurance. That's completely different.
This is easy. Okay, just right now.
I have a question regarding the observation status. My husband was actually admitted for observation status and stayed for 6 days. Is that unusual?
I can't answer that for sure, but I probably not.
What does it mean, though? I mean,
It
in
means
terms
that
of
he's
what
covered under
Medicare
Part
pays.
B instead of Part A.
Oh, okay.
So he would have that 20% copay after he has met that Part B deductible. It's a difference in payment.
Okay.
I'm sorry, I have another question.
That's okay.
You know, the Medigap policy that you purchase along with your original Medicare,
Mhm.
and then you purchase a Medigap policy that picks up the extra 20% that Medicare does not pay, correct?
If you have a Medigap policy.
Right.
And Medigap policies only go with, you're right, regular Medicare.
Now, would you not need that Medigap policy because they don't pay very much? They pay 20% of whatever, you know?
No, Medigap,
Would
it
you drop
depends
it?
on which plan you pick. So let me get my chart out here. I'm looking at this chart with the green on it now. So, or no, wrong one. Pulled the wrong one. I'm looking at the chart with the orange on it. Okay. So if you look at, let's look at Plan F. Plan F covers the Part B deductible and any excess charges. So it's going to cover the whole 20%.
I know, but what I'm saying is, maybe I don't want that Medigap policy. I don't have to purchase it, do I?
No, it's private insurance.
Because that is usually it's very expensive.
Right. You don't have to purchase one.
You could just pick up the 20% yourself.
Correct.
Okey doke.
Coming back here again. Our online folks are quiet. No questions? You have explained things so thoroughly.
They probably fell asleep. I usually do when I'm online.
I'm currently here on the waiver program. So I
Yes.
know I'm limited to the choices of Anthem, Care Source, and Molina.
Correct.
So when I was with my broker, when I told him that, he immediately went right from what I was currently on Advantage plan with United Healthcare. So he said I couldn't have that this year.
You can.
26.
You can still choose. So if you're on MyCare Ohio, you can still choose any Medicare plan you want. But you have to choose those other three for your Medicaid.
Okay, so I don't have to go to the special needs plan?
You can still choose to have your Medicare separate.
Okay, gotcha.
Okay. It's confusing, but they can't take away your right to choose your Medicare. So if you want to stay put, you can do that. What I will tell you is, you might want to have somebody here send you a comparison of what you would get under the three plans, because the comparisons are out now. I can give you a copy of that if you want. And you need to know that if you choose a Medicare plan outside of that MyCare Medicaid plan, you're going to be dealing with two different payment systems. Okay.
So from what you just said, you can pick your Medicare Advantage plan and your Medicaid plan can be separate under those 3 or 4 that are available.
No, you don't have, the Medicare plan doesn't have to be with those 3. It can be any Medicare plan.
No, any Medicare plan, but the Medicaid plan. So you
The
can have-
Medicaid has to be with those 3.
Okay, so you can have one company for your Medicare Advantage plan and a separate company for your Medicaid.
Correct.
And the broker or whoever is will set up 2 different.
I don't know how much brokers know about MyCare Ohio.
Because it seems they want to just lead you into one company.
I think you should call the Medicaid hotline, get a copy of the MyCare choices, because they'll show you what benefits are covered if you're just Medicaid only, and what benefits are covered if you have them for both Medicare and Medicaid. And then you can decide.
The Medicaid hotline, you say?
Yeah.
I have a same Medicare Advantage plan for some time now, and I noticed the last 3 years the coverage for dental is going down. And all of a sudden, I'm getting all these emails, all this mailed material on additional dental plans. Is that the trend, to get rid of dental from the Advantage plans and go to paid plans?
What we're seeing this year, probably because some payments are being reduced, that many Medicare Advantage plans are reducing their benefits. So whether that becomes a trend in the future depends on a lot of factors.
Any other? Ooh, hands went up all over the place. Okay, I saw Teresa first and then.
Just to piggyback off the question that the lady in the back had about delaying her Medicare enrollment because she has insurance with her employer. If you do that, do you still have to pay that percentage that you mentioned if you delay your Medicare enrollment?
You mean the late penalty?
Yes. sorry,
No,
Yes.
as long as you tell the
Okay.
Social Security Administration you're delaying it. And as long as your current employer has insurance creditable to Medicare, and your employer has to give you a letter every year that says whether it is or not.
I saw a flurry of hands here in the center. Henry?
Thank you. It seems as if we can switch from Medicare to Medicare Advantage and back to Medicare, back and forth. But here is the question. When we are originally on Medicare and we buy a separate Medicare supplement, all right. Now, if we are on Medicare Advantage, we do not need that Medicare. But say you're in it for 10 years or 15 years or so, then you want to switch from Medicare Advantage to Medicare and buy Medigap. Isn't that more expensive?
Yes,
A lot
it would
more.
be, it probably, depending on if you have pre-existing conditions. So yeah, you can switch back and forth, but if you switch from traditional Medicare and you have a Medigap plan and you go into a Medicare Advantage, you lose your Medigap plan because you can't have both. So trying to get back into a Medigap plan could be problematic.
Other questions?
Just a quick question. Are there agencies like you in every state to help people with this? I have friends in Florida, and I had told her about this meeting we were coming to today. And she said she didn't know if they had anything like that in Florida that would help them. Do you know if there are agencies?
Yes, every state has a state health insurance information program. So I mentioned OSHIP, that's Ohio's, that's where the O comes from. Florida has one too. Every state should have one. So if she looks up her SHIP, she should be able to get assistance.
Any other questions? We overpronounce OSHIP.
Yes.
Like really emphasis on that last.
My understanding is that your Direction Home does not give you, act like a broker.
in picking the insurances.
Oh, no, we don't help you pick an insurance. We are an independent source. We don't enroll. Even back in the day when I would actually do analyses, I don't do those anymore. I send people to OSHIP. Even when I did, I never enrolled anybody. We're a nonprofit, as Lori told you. We do get federal and state funds, but we're not a government agency, which is why I'm standing here today.
We're still working. Okay, over here.
So does OSHIP enroll you?
I believe they do.
Okay, I saw other hands.
Up here.
Whew, okay. Here we go. Need somebody to tell a story while I walk to the other side of the room. I am going to have to look at my steps when this is done. Okay, where were the hands again? Go in a circle.
If you're looking at your medications and they say you have a $500 deductible, under what we're on now, traditional Medicare, they say you have a deductible, but we've never had to pay for, I guess they call it preferred generic.
Yeah.
So is that still with the Medicare Advantage? If you go to
Yeah, it can be. A lot of times Medicare Advantage plans will not charge for preferred generics.
Okay.
Yeah.
Thank you. And then Jeannie. Sure.
When they're determining your assets and income, is that as a family or an individual?
If you're married, they're
Yes.
going to look at you jointly,
Jointly.
married couple. Yes.
That's what I figured.
Okay, sure. Anyone else? I haven't seen anything online, but I've seen a few people assure me they are indeed awake. So
That's
let's
great.
see. Got wide awake, Francine. Okay, we do have. If you are on MyCare Ohio, you have to select your Medicaid plan from 3 options for 2026. Medicare plan can be the same plan as Medicaid or whichever one you want. So that's a comment from Shannon. Thank you.
Yes, that's what I said.
Yep. Okay. Anything else from in our room? Oh, it's the only way our Zoom peeps can help.
Ah, thanks. First, I want to say thank you because I've been doing this many years.
You're
from
welcome.
When my mom and dad didn't know what to do and I had to take over, I didn't know what to do. So you're a blessing. Now I'm old and we're doing it now for us. My question.
I'm old now too.
My question is, we're on traditional Medicare, but have started looking maybe at an Advantage plan. If you get an Advantage plan here in Summit County
Uh-huh.
and you move to Wayne County or us looking to go towards where our grandkids are near Columbus, how does that Advantage plan move with you? How do you work it?
Okay. So
Traditional allows me to do anything I want.
in
basically.
our 4 counties, most of the plans, not all of them, but most of them are in all 4 counties. You can check. Now, if you move out of the county, you have to choose a plan with the plans that are in that county. So the plans can be different in every county in Ohio. Okay.
Like, okay, so we move now and, or we move in January. We started our new
Okay.
Advantage plan. How long do you have? Do they give you a time frame? Are you, like on the
Well,
one
they
in
have to
Summit
cover
County?
you for emergencies. But if you know where you're going to move and you're going to especially move out into another county or
Correct.
like far away from here,
Right.
I would definitely choose your plan before you move and have it go into effect
Okay.
that month.
Okay. But at this point, it's very expensive to move. So we're still looking.
Yeah.
So if you want to move, but you don't have that
advantage of knowing, yes, I'm gonna move this month.
Yeah,
or
just stay
whatever.
put until you know you're
Okay,
moving.
and then start investigating it.
Right.
All right, thank you.
And OSHIP can help you with that too.
You guys are such helpers, making me go from one side of the room to the other. Thank you for helping me with my exercise today.
I just wanted you to see, ask if you could educate people on the fact that you just brought it to mind that if you're a snowbirder or if you want to
Mhm.
go out of the country for a period of time, what your benefit
Okay.
is.
If you're a snowbird, some plans are what we call national plans. An example of that would be the AARP plans. So let's say you choose an AARP plan and you're in Florida for 6 months. They're a national plan. They're in Florida too, but they're going to cut your coverage is going to be based on what the coverage is in that plan in Florida. So you're still covered. If you're in a local plan, you need I don't know if SUMA covers if you're a snowbird. You'd have to call and ask them. The local plans. They do? Okay. So you need to ask that question to make sure your coverage, but generally the national plans will follow you if you're a snowbird.
Anything else? No?
Yes.
Oh, we do have one. I'm coming.
On this list that we have, do they say if they're national or not?
No.
So how would you know?
You just call and ask. The big ones are all national. The Anthems, the AARPs, the Humanas.
Okay. Anybody else in the room?
The AARP now, that's also United Healthcare?
Yes.
Yeah, okay.
Anybody else?
Okay.
None.
Well, thank you
All
all
good.
for coming. It was a pleasure seeing you. I recognize some of you that I've seen through the years. And hope this was helpful. Thanks again.